So my name is Lou Kopas, and I'm a chief of midwifery here at the Northwest Hospital Midwives Clinic. And I'm actually employed by the University of Washington. I'm appointed faculty in the School of Medicine Department of OBGYN, and my title is chief of midwifery. But I practice and deliver babies at Northwest Hospital, which is part of UW Medicine. So there's a lot of buzz in the medical community about the microbiome in recent years, and what that is the population of bacteria that live in our bodies and on our bodies that are sort of not harmful bacteria, but beneficial bacteria. They live in our gut, and they help us digest our food, and so, but they're all over, and we're realizing how important that microbiome is, that it's part of our bodies. And different parts of medicine have been realizing that. So it's been a lot of a buzzword recently. So with birth, what we find is, baby goes from being in the womb where things are sterile, and the baby has, no bacteria on its body or in its body, is born through the vagina, and that it's picking up some of that mother's bacteria, the beneficial bacteria, by coming through the vagina, going onto the mother's chest, starting to breastfeed, and the baby is, in a sense, inoculated with the beneficial bacteria. So at birth, the fetus is going from being in the womb where there's no bacteria, it's sterile, is born through the vagina, and what we believe is that on the way out, the baby's picking up some of this microbiome, some of these beneficial bacteria from the vagina. Then the baby goes onto the mother's chest, starts to breastfeed, and is again getting bacteria from the mother's skin, from the mother's milk. And we've known for a long time that the gut bacteria of a baby who's breastfed is a much wider range of diversity, if you will, than a baby who's bottle fed. A baby's bottle fed has a very narrow range of the genetic types. The wide diversity is better. And they find it affects not just your digestion, but it actually affects your immune system. It affects some autoimmune disorders. And so that could be part of the reason that breastfed babies have lower rates of type 1 diabetes and asthma and allergies, some of those autoimmune things. But there's also been some focus on the from the birth and the birth canal, what the baby's picking up. And there was some large studies that looked at babies born by C-section, particularly planned C-section without labor versus a baby born vaginally, that there's a difference in some of these illnesses, such as asthma and type 1 diabetes and autoimmune disorders, and they think that there's a difference in the immune system. And so there's this focus on the vaginal microbiome and how that's beneficial to the baby. And we don't have all the answers yet, but it's compelling stuff. What's come from that is there's been a big international study that's doing this thing where they call it a vaginal tampon. They literally just take a piece of gauze. When a mother's going to have a C-section, they put it in the vagina and let it sit there for an hour, and then when the baby's born, rub that all over the baby and give the baby that. Yeah, rub that over the baby's face. And give the baby that exposure that it would have had going through the birth canal. What we do at Northwest Hospital is what we call a family-friendly C-section, where we want the baby to get skin to skin on the mom as soon as possible, because the mother wants the baby wants to be with the mother, and there's probably also benefit for the baby to be there. But this added step has not become a policy for us, but we are having people ask for it, because we've had people say they want to do it, and we don't know any harm to it. I think the jury's still out on what the benefit is. But babies do come through the vagina. That's kind of physiologically how most babies are born. And so patients who want to do that, we're saying, yeah, you can do that. Usually we have the partner or the dad, do that. I recently had a patient who went to the University of Washington, and she said she didn't, she had complications of her pregnancy where she had to have preterm birth, she had to have a high risk, and she was happy to have all the intervention she needed. It was not what she planned. And she said, the one thing I got was that gauze in the microbiome. She says, I want to have this. It's the one part of my natural birth plan that I want. And I said, okay, you can do that. It takes a while for research to change into practice, and something has to be kind of proven. I mean, it sounds kind of silly to think, well, logically, what harm could there be to taking this gauze and rubbing the baby? It sounds weird, but what harm could there be? Because that's where babies normally come through. But you need to have a lot of studies before you start having that policy in the hospital. You need to know that you're not doing any harm before you start doing something new. So I think that's where we're at. And interestingly, the consumers, on some level, are maybe ahead of that because, or maybe they're advancing that because they're asking for it. And there's a lot of knowledge and particularly in the Seattle area, people are really into being proactive with their health. They eat well and they're doing probiotics, and they're learning about the benefits of probiotic foods and probiotic supplements, and they're doing that for themselves, and they're asking for the microbiome for their baby.